Savvy Social Worker Exam Prep. I am just coming to you guys with a brief video explaining the family roles in addiction, and this is usually when we are talking about substance abuse. So if you happen to come across a question on the ASWB exam that is giving you a scenario and they're asking you what role is this person serving, or vice versa, they may give you a role and want you to describe that role or pick an answer choice that describe that role. Hopefully this video will serve the purpose of helping you to be able to remember, retain, and recall the different roles in addiction. Okay, so let's get into it. I am using the Simpson family for illustration purposes. Hopefully that will also help you to recall this information a lot easier. Okay, so first, the obvious role we have is the addict, who is the substance abuser. That's usually one of the parents or one of the primary breadwinners in the home, and that person is usually in denial. The second role, or the next role we have, is the enabler. Grand old Marge here. This person is usually a spouse or a significant other. They step in and they take care of the things that the addict is no longer doing because of their addiction. So that means, that could be, maybe picking up extra shifts at work because the addict is not working as much, or having to bring the kids to and from practice because the addict is unavailable now. They typically will try to make excuses for the addict's behavior. And they think that they're protecting the addict, but overall they're just masking the larger issue, and it makes it more challenging to heal for the addict. But the enabler doesn't know that. They just feel like they're doing what's best. Okay. The next family role is the hero. Little Lisa here, where they step up their responsibilities. It's usually an older child in the home. Um, and they usually cope by seeking perfectionism, usually involved in a lot of activities, keeping themselves busy, taking on more responsibilities. Some of these responsibilities include some of the responsibilities from the enabler. So now, since the enabler is taking on a lot of the responsibilities from the addict, the hero kind of steps in and tries to take on some of the enablers responsibilities, like maybe cooking around the house, cleaning around the house, now that the enabler is probably working more hours or having to do more running around. So they're taking on more responsibility. The hero, because of the position that they put themselves in as a leader and taking on all these responsibilities, may experience extreme amounts of stress and become unable to manage their anxiety. This leads to anxiety growing up into adulthood as well. When they're so used to taking on the responsibility and the problems of others, it makes it hard for them to manage their own anxiety, and they can take these behaviors and attitudes, even on their job, taking on, overworking, burning themselves out, taking on extra responsibilities. The next role is the scapegoat, and this is Bart. There's a list of behaviors that normally comes along with this role. This person often gets blamed for many of the family's issues because they act out in negative ways as a result of the household chaos. One of the family members struggling with addiction, the household is chaotic, so the scapegoat covers up or draws attention away from the real problem, which is the addict. Commonly, the scapegoat of the family will eventually be unable to manage his or her anger and act out in avoidance behavior. So, going into adulthood, this normally becomes the black sheep of the family. So yes, so seeing questions on the exam that will probably ask this person is considered the black sheep of the family, growing up in a home with a father who was an alcoholic, whatever. What is this person known as, or whatever? And you would answer that as being the scapegoat. Okay, that's just a brief example of the type of question you may see in regards to how these family roles work. The next role is the lost child, which is baby Maggie. You know, Maggie normally is always off doing her own thing in her own little world, not bothering nobody. So these people, they normally cope through isolation. Usually they're one of the younger kids in the family. They're silent, they stay out the way. A lot of the younger kids, they kind of get lost in fantasy play or video games. They use that type of play as a distraction to distract them from, of course, the chaos that's going on in the household. They're quiet, they're reserved, and they're careful not to cause any issues that's going to draw any attention to themselves or cause any additional chaos in the home. And last but not least, y'all, that's all I had left. But we're gonna go with it. The mascot, which of course, when you think of mascot, think of an animal. So, they had these the pets. I think Santa Claus or something like that was the dog, and Snowball is the cat. But the mascot usually chooses humor as a coping mechanism in order to bring comfort and release as a means of trying to balance their stressors in the household. Okay, so everything that's going on in this chaotic household, you would kind of consider the mascot as kind of like the jester or the class clown. They go to school and they want to be the class clown. Most commonly, the mascot in the family is the younger sibling. Doesn't always have to be the younger sibling, but it is one of the youngest children in the family. They're very fragile, vulnerable, and desperate for the approval of others. So providing comic relief is also the mascot's defense against feeling pain and fear himself. Mascots often grow up to self medicate, perpetuating the cycle of addiction. So, and this is not, all 100% guaranteed. This is just one of those risk factors that when you serve as a mascot, trying to, basically, I think a mascot, I'm thinking, okay, he's masking his true feelings, he's covering up all the pain and the hurt that he's feeling and the confusion and maybe anger. He's putting a mask on that and he's masking it with humor. So normally when he grows up, he's so used to not dealing with his true emotions that he turns to alcohol or drugs as the new coping mechanism as he gets into adulthood, which continues to perpetuate the cycle. So yeah, y'all, this is it in a nutshell. Hopefully that this was helpful for y'all. Leave me some comments or what do y'all think about the video, any suggestions. And always, I appreciate y'all for watching. Thanks for your time.